millions of them. But I'm also the director of UCAN, Universal Health Care Action Network, and we are a network for grassroots groups all over this country who play a major role in getting the ACA passed to begin with and are fighting for healthcare justice every day. So it's an achievement that we've slowed it down. That doesn't mean we're going to win by any means. But what they've done now is they've moved up the timeline to deal with Medicaid. And that's Medicaid doesn't get as much attention as the Affordable Care Act. And I know Lauren here can say a lot more about that, but they are proposing to radically restructure Medicaid with this idea of block grants and cap per capita caps. It all sounds like a lot of wonky language. It means cutting Medicaid significantly, no longer guarantee that you will have the coverage that people need. I mean, why do we have Medicaid? Because people can't, when you're low income, you can't afford to buy insurance, right? And it has been a huge help here in Ohio that we've had the Medicaid expansion. Huge. Right, so I just want to say, our members in Congress, they may be outnumbered, but they've got all of us, right? Right. So keep doing what you're doing, like coming here today.
I'd also like to continue the conversation on Medicaid. Thank you for pledging to support the ACA, Medicaid, and Medicare. My name is Holly Jensen. I'm 32. I'm a small business owner. I am connected to Caring Across Generations, the Ohio Association of Area Agencies on Aging, and Fair Care Ohio. Medicaid saved my life. I need to know the odds, realistically, that Ohio's Medicaid expansion will be preserved in the next few years, and how can we, as your constituents, support this through potent, practical, and concrete actions.
Thank you very much. I'm going to take that. I might just there is right now, and she's absolutely right, and I was reading about it yesterday, part of the plan that the President and our colleagues in Congress have about the bill is that they want to literally cap Medicaid. They want to allow states to determine how much Medicaid and who can receive it. And so the first thing you need to do is get your state representatives and state senators and tell them we're not going to put up with that, because they ultimately are going to make that decision. Even if it's block grant to the state, your governor and your state legislature are going to ultimately make that decision. So you need to start to tell them now, don't touch it. Leave it alone. Because if not, our state house, and I know the Sister Williams here can tell you, they're just as bad as the people I work with. And to make it worse, because they don't understand it. They make decisions that the ramifications will be seen long after they're gone because they have no clue what they're talking about. I won't say they've done us a box of rocks, but they are. So that's where you start. You start with your state reps and your state senators. And thank you, I'm glad that you said that, because people think that this is all just pie in the sky talk. I'm glad that you are willing to say that it really makes a difference in people's lives.
It does, thank you.
Thank you.
Good morning. My name is Dr. Margaret Stager. I'd like to say thank you to everyone on the panel and to Congresswoman Fudge. We really appreciate your time. Look at all the people here that want to know exactly what's going on. So thank you. I'm a pediatrician. I work at Metro Health Medical Center, and my specialty is adolescent and young adult medicine. And I'm here to share with you and tell you how the Affordable Care Act has helped our patients. I see teenagers who have a lot of needs. I also see the urban poor and those that are the working poor and struggling. The Affordable Care Act has helped their families tremendously through programs, and additionally as well, like SNAP and CHIP and so forth. But the group that has benefited the most are the young adults, the 18 to 26-year-olds who have been now given the bridge of health care coverage, whether it's through their parents' coverage or through the Affordable Care Act. And particularly, I want to emphasize the young women. I see 6 girls for every 1 boy in my practice, probably because I'm a female provider. But these women have benefited from access to contraception. And because they've had access to contraception, they've been able to plan their lives. They've been able to plan their college, their secondary education. They've been able to get on with their lives. and plan when they're ready to have a baby. So access to contraception is so important right now.
The doctors, I'm going to be doing, this is one of the other things we're going to be doing. We're going to be doing some very big press conferences to talk about why the ACA is important. And I know how people trust their physicians, so I thank you all for being willing to work with us to continue to keep that out there all the time. Thank you all so very, very much. Somebody was telling me that the Republican draft of the ACA bill repeals the Medicaid expansion in 2020.
Yeah.
And I also want to thank Metro because they came up with one of their own programs to assist the poor, and I thank you for that as well.
I think there's a number of doctors and nurses in the room, and they are some of the most important voices on healthcare. I'd like them all to raise their hands or stand up. Look at this, folks. All right.
That's outstanding. Thank you so much.
Congresswoman, if I can add a little bit on the Medicaid expansion conversation. So some of what's being discussed is basically a phase-out, where coverage would be eliminated for the group or made optional. There's a whole host of effects as to why that's bad. If you're interested, the state of Ohio, the same state house, demanded that the Department of Medicaid work with Ohio State and do a comprehensive review of the Medicaid expansion, looked at 700,000 claims for 7,500 people, saw that people got healthier, that they worked more often, that they could afford housing and food, address a lot of these social determinants of health that we're talking about. The doctor just mentioned access to contraception, access to prenatal care. These types of things matter in conversations around things like infant mortality.
Yes.
But I think that there's also something beyond what's happening on the federal level that people should be aware of and also talk about in the State House, and that's around these waivers. There's a lot of discretion that the Centers for Medicare and Medicaid Services has around implementing and changing regulation relative to Medicaid and Medicare, and that's where a lot of the ACA actually existed. And so a couple of years ago, for anybody who's a nerd like me, there was an 1115 waiver that would require more cost sharing for Medicaid recipients, and this included foster children, this included women with breast and cervical cancer. This is going to happen again, and this is going to be the conversation. No matter what law gets passed, regulatorily, there's going to be a lot of changes coming up. So you have to stay aware, you have to stay engaged in the conversation and make sure you're not only speaking with the folks like the Congresswoman, but the State House is going to be extremely important because that's going to affect so many lives as well.
Thank you.
Good morning. I represent the law office of Margaret W. Wong and Associates. I'm Michael Patterson. We're an immigration counsel. Needless to say, these are trying times for us now. I just wanted to ask you, are there efforts being made to reach out and work with the business community to combat the Trump proposals and to give us comprehensive immigration reform? Because from what I've seen of it, business is surprisingly very supportive of it, even some very conservative business people.
Well, I mean, I know that the White House has reached out, but let me just be real honest with you, Michael. When the president started out his campaign, he so poisoned the water on immigration that there are a lot of people who believe, as we believe, that immigration is a good thing, but they're silent. You know, a lot of these businesses that want visas, that businesses that use immigrants, they're afraid right now to take on the president. So I am hopeful that as more members of Congress and more people in the community start to be vocal about this, it will